what can you say to people to help them keep their teeth healthy and keep them longer?
I have a lot to say to you, Jason. And first of all, thank you so much for inviting me to be on your show. I feel very honored. Keeping your teeth and keeping them healthy longer. Well, let's start with the basics. If you grew up during the fluoride era, which means you are probably 70 or younger, then your teeth are probably in much better shape than the people who are 80 plus. You wake up in the morning and you brush your teeth. What do you brush your teeth with? And what do you do after that is very, very important. You brush your teeth with a very non-abrasive toothpaste. And we could talk about that because some toothpastes are better than others, especially if you're over 55. And you want to use a mouth rinse. Not every dentist recommends it, and they should because it's a great adjunct. And keep drinking a lot of water. Water takes the food off of your teeth during the day and it hydrates you, and it's the most important thing to do as you age and for your entire life. And then if you can, brush your teeth after every meal, and definitely the most important time to brush your teeth, which some people don't know, they were never taught to do this, is to brush your teeth before you go to bed. And that is because you have a full day of food laying on your teeth, and you probably don't even realize that the food is laying at the bottom of your teeth against the gum line, which would cause you to have either decay or periodontal disease. So if you could add flossing in at least once a day, then you will keep all of your teeth. I do have some products that I'd like to recommend. I don't generally recommend anything that I don't believe in 100%. And these products I recommend 1,000%. And what's great about them is they're found right on the market, on the shelves of CVS and Walgreens and whatever local pharmacy you have. It's a relatively great line. It's called Closest, and it's this line, the plus 55. It's the silver line, and I hate to admit it, but I'm 60, and this is the product I use. It's very, very, very different, and that's why I want to bring it up today. When I first started using it, it took me a while to get used to because it doesn't suds. There's no sulfates, which is what most toothpastes have, and it makes you feel like when you wash your hair, the suds, that's a sulfate. But sulfates can be very irritating to some people. And when I see patients, and I only do house call dentistry, I don't have an office anymore. But when I see patients who have canker sores, the first thing I figure out is that they're either using something with alcohol, which is very abrasive. So we don't want to use anything with alcohol as we age, or that they're using something with sulfates. So you want to have no sulfates if you can possibly help it. And this is the only one that I know that does not have sulfates. I'm sure there are others, but this is the one that works for me. And they also make a rinse. So at night, I always brush, and then I always use the rinse. And then during the day, I'll use the rinse. And it's so great because you feel the difference that it makes on your teeth. Your teeth feel definitely a lot smoother and cleaner. So brush, floss, and use a rinse. Fluoride is very important. Some people hate the taste of toothpaste and mouth rinses, and the one thing that's good about the Closest products is that they come non-flavored. So I like to say that they're the gentlest products on the market, and it's the truth. So any other questions?
Plenty, yes. So let's go back a bit, Dr. Kaufman. Talk to me about getting into the geriatric dentistry.
How did I get into geriatric dentistry? Well, I hate to admit this, but I was the dental nerd in dental school, and I loved making dentures. And that's kind of crazy because when my classmates were doing their thing, they were learning how to do veneers and whitening, and here I was working on dentures, which is like the booby prize, right? But I hung out in the dental lab, which was very untraditional, even back in the 80s. And there was two guys in there, Pete Now, and they were like 100 years old when I was in dental school. And back then in the 80s, you could do anything you want. So they would sit there and chain smoke and teach me all about dentures. And I remember them saying, you know what, Elisa, you have a skill that not everybody has, and you must not give it up when you open your own practice. And when I moved to New York, I always advertised that I was good at doing dentures, and one thing led to another. And eventually I sold my practice to make house calls only. And now I'm making dentures in the home, and I just love it, love it, love it. I wish I could do a denture a day.
So can we start with what is a denture? And
What is a denture?
yes.
A denture is a prosthesis, like when you need a leg replaced. So it is fake teeth. They are not meant to be your own feeling teeth, but they are something to help you chew and help you have a great quality of life. You can smile. They're made of different plastics, and there's all different types of teeth that you could use. So for your listeners out there, if you're going to get a new denture, it's very important that you ask the dentist what kind of teeth they're going to be using so that they look real and they don't look like plastic. And I try to make them look very natural. So I get a picture of one of that they might have from 20 years ago, if they had spaces, if they were crooked, and I try to make them look like their old selves. But dentures are not that easy to wear. There's a lot of difficulties getting used to them, but you know, people do, and I can only encourage them that it's one step at a time. And the first day that you would get a prosthetic leg, you'd be so excited to stand, and the second day you'd be so excited to maybe take a step. And it's the same thing with dentures. You have to give yourself time to get used to them, and you have to be very involved with your dentist, and he or she has to be very patient, because there are a lot of adjustments that need to be made before they're perfect. I always ask my denture guy to put the name in the teeth as well, because God forbid you go in an ambulance and the ambulance is trying to give you, you know, something through your mouth, and they have to remove your dentures. The last thing they're worried about are your dentures. They're trying to keep you alive. So I always ask my denture lab to put the name in the denture. Even though there are some HIPAA issues with that. I mean, they're in your mouth, and God forbid you lose them. I think it's more important that we are able to give back the denture to the person than the HIPAA rules. But, you know, I hope I don't go to jail for saying that. But I feel strongly about that. I work in nursing homes, assisted living, and people's homes, and it's very important that dentures don't get mixed up.
Are there some do's and don'ts as far as somebody that's wearing dentures for the first time that they need to be aware of?
Yes, do's and don'ts. Never, ever, ever try to adjust your own dentures. Never. Never, ever try to repair your own dentures with crazy glue or anything that you find over the counter, because once you touch a denture, it's not fixable. But if your aid, or if you by accident drop it in the sink and it breaks into 3 pieces, you take the 3 pieces, you put it in a Ziploc bag, and very easily it can be fixed by your dentist, and usually like a day or so. So it's important that you take care of them, that you don't brush them with a hard toothbrush and your own toothpaste. There's products that are on the market. One that I absolutely love is made by Dr. Burland, and he has products that are great for denture wearers. He makes an adhesive. Here it is. I have a few products that I love. This is called Adhesident, made by Dr. Burland. I'm going to show that right on the camera. And I'm going to tell you, I don't recommend anything that I absolutely positively don't love. I'm not being paid by any of these people that I am recommending. Know that in advance. Adhesident is the crazy glue of denture adhesives. It's ADA approved, which not everyone else can say. And it does not dry out your palate. And if I wore a denture, even if the denture fit well, I would still 100% want to use adhesive to make sure that it never moved. I don't want to laugh or dislodge it in any way and embarrass myself. So I really believe in denture adhesive. There are partial dentures that some people wear, which means they have a few teeth and there's hooks on the dentures. So there's different types of partial dentures that you could ask for. You could have clear clasps. You could have a softer denture. You could have one that has metal clasps. You could have ones that lock into implants. There's all types of dentures and denture materials that are out there. And I think that it's important that your listeners, when they go to the dentist, that they ask a lot of questions. Like, when I smile, are you going to see the hook on my tooth, or is it going to be invisible? So know that there's a lot of options, and you just have to be knowledgeable. And I think that's what your show is called, Knowledgeable Aging. So as much knowledge as I could give you, that's my job.
Should people sleep with their dentures?
You're trying to give me a heart attack on a the first day of the week. Okay, this is really, really important, and I'm going to get closer and closer and closer to the camera as I say this. If you sleep in your denture, you will be wearing the bone out that the denture is on. You cannot sleep in your dentures. Now, if you're on your second marriage and your new boyfriend, partner, spouse doesn't know that you have a denture, that is the reason people sleep in their dentures. And I hear it all the time. My wife doesn't know I have dentures. And I feel for these people because, yeah, you have to sleep in your dentures. What can I tell you? But for everyone else, take out your dentures, soak them to remove all the plaque and bacteria that build up. And Dr. Berland makes a great soaking product as well. And, you know, use a special denture brush to take off the food and the bacteria and give your mouth a rest. I mean, for God's sake, I know your shoes and your sneakers could be comfortable, but do you sleep in them? No, it's the same thing. You need to let your mouth rest, and you need to clean your dentures. They build up with the same kind of bad and good bacteria that's right in your mouth, and you must remove the food, and you must remove the bacteria, or else you're going to get infections. So please, 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 unless you're the one exception that I already spoke about, unless you cannot tell people that you're wearing a denture, take out your dentures every night.
Is it safe to assume, Dr. Kaufman, that there are or are not a lot of geriatric dentists?
Well, it's safe to assume that they're not easy to find. I'm really working hard to engage young people. I'm lecturing to different universities, dental universities around the country, and even to residency programs about how necessary it is to not only treat the geriatric population, but to be able to go into their homes if need be. I mean, what do you do if someone's on hospice care and they are not able to get out and they're swollen? I mean, there has to be dentists that are trained to go into the homes, you know, and that's going to be my legacy eventually, is that I will have geriatric dentists that will go into the homes, hopefully in every area of the country. That's my dream, and I can only hope, right?
Yeah. So geriatric dentistry, working with dentures.
Right.
How did you ease into house calls?
How did I ease into house calls? First of all, being in Manhattan made it a lot easier because people are packed into a little space. Mm-hmm. So as my practice grew, and I had my own practice only for 5 years because I decided to then do this full time. But as my practice grew, people got older and older, and they actually couldn't come to me anymore. And I had a girlfriend whose dad had a stroke, and the mom asked me if I would come over and take a look and maybe clean his teeth, and that worked out really well. And she told her friends, and then, you know, I had this epiphany that this is probably an area, especially in an urban city like New York, that people would love having someone come into their homes, especially if they could trust them. They knew they were knowledgeable and qualified and you know, and experienced with dementia patients, with Alzheimer patients, ALS patients, frail patients. I mean, there's so many different types of patients that need a house call. I even have very, very large patients who can't get out of their homes just because they weigh too much or there are steps involved. So there's all types of reasons that people need a house call. And, you know, I'm busy every day. I literally love what I do. And I think that the love for it has grown into a referral base where people say she loves doing this. Like, when she comes to the house, you're going to enjoy having a dental visit. So, you know, I try to be funny and upbeat, and, you know, I try to get my dementia patients to participate. I'll tell them that I'm their daughter's dentist, or you know, that their dentist sent me, and I try to get fake compliments that I don't look like a dentist. And I just absolutely, I mean, and I'm nosy. I love going into people's homes and checking out their, you know, their family pictures. And, you know, it's so much better than going to an office every day. It's just the most exciting thing that I can do on a daily basis. I mean, I'm going to see a patient after this, and I can't wait because he's one of my favorite patients.
Very good. So, Dr. Kaufman, what goes into house call dentistry as far as the services you provide?
I don't provide anything that's dangerous to do in the home. So let me just start out with that statement. So if there's a really broken down molar and the patient has advanced dementia and they're screaming and we have to perhaps hold them down, that will be a patient that I will say to the family, you know, we really need to get them to the oral surgeon and we're going to have to sedate them. So just let me say that. The things that go really well at a house call dentist, the procedures are dentures, extractions, small fillings, exams, x-rays if they don't have dementia. And I always ask for old x-rays if they do have dementia, because if I have to take out a tooth, the old x-ray shows me the morphology of the tooth, which doesn't change. So that's just as good. I do fluoride treatments. I do silver diamine fluoride treatments, which is when the patient has decay, but it hasn't advanced enough to become a real issue, and they have dementia, I will put on a solution that hardens the decay. This way we know it won't go to a root canal or a rotted tooth that needs to be extracted. So it arrests the decay, and that's the brand of the product, brand name of the product that I like, and it just will help your viewers if they want to look into it themselves. It's just called Arrest, and it's something that I really, really could not live without. So that's one of the products. So there's a lot of things that you can do, more things you can do than you can't do. You're not whitening teeth. You're not doing any implants. You're not doing crown and bridge. If a crown or a bridge falls out, I can cement it. But you're doing the basic services that the elderly need.
Okay. So, Dr. Kaufman, what happens to your mouth as you age?
Well, first thing that happens is that your mouth dries out a bit. And I don't know if I'm nervous or I'm just thirsty or my mouth, or I'm 60, but.
I'll drink water with you.
Okay, good. So your mouth dries out. So it's very important that, I said that before, water, 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 whether it's sparkling water, regular water, drink water. Your teeth become more sensitive because you've been brushing them for your entire life. So it's very important that you don't brush very hard. And as much as you love the feeling of a hard toothbrush, you heard it from your dentist and now you're going to hear it from me, that you should be using a very, very soft toothbrush, and not all toothbrushes are the same. This is the only one that I use, and I'm going to show you am I in the camera?
To your left.
To my left.
There you go.
Ooh, you see the little hairy blue tips?
Yes.
Those little hairy tips go underneath your gum line, and for the geriatric patient, they easily go into the crevices or the spaces between the teeth. So I love this. This is made by Sunstar, and it's the name of the toothbrush is Gum. So I love this toothbrush, and it's the only one that I will give to my patients unless they have dementia or Alzheimer's disease, in which case there are some toothbrushes, Colgate one of them, that puts a rubber on the back side, and that's important for the dementia patients because they will bite the toothbrush and that might make their teeth or their crown or their filling fall out or break. So that's an issue we have with our dementia patients, and that's a big problem. And what I use on all of my patients that have that issue is this bite stick. I've actually invented a new one that has not come out yet, hopefully this year. And this you can order. It's made by Sage. You could look it up online, and it's a foam block that does not harm the patient. It's very hard for them to bite through it. I've only had one patient in 35 years bite through it, and that patient actually bit through my fingernail after that. First time, my only injury ever. But what you do is you have them open. You could put a little like honey or something if they think it's a spoon and they won't open. So if you're a caregiver and your loved one has dementia, if you get these foam blocks until mine comes out, and that'll all be on my website, Geriatric House Call Dentistry, when mine comes out. But until then, this is my go-to. I'm in love with this product made by Sage. And if you hold it with one hand, your left hand, and brush their teeth with the right, and you can move it around, then you you don't have to worry about getting bitten, and you can get them for your caregivers, or you can, if someone has ALS and they can't open, this is the only thing that works for now. So I love this. So I'm hoping that you guys don't mind that I'm giving you product advice. Obviously, that's only one person's opinion, even though I think I'm right. These products that I'm telling you about are over the counter and very easy to find, except for Dr. Berland, which you can go on my website because I talk about it, and then you could go on Amazon or go on his website and purchase them.
Dr. Kaufman, I'd like you, if you could, talk a little bit more about some experiences working with those with cognitive impairments. You've already mentioned dementia, Alzheimer's.
So it's difficult, it really is. I mean, the first thing that you have to be as a house call dentist is extremely patient. I mean, things arise when you're working on this population of patients that would never happen in an office, such as they need to go to the toilet. So in the middle of everything, they have to get them up and to take them to the toilet. So you have to be extremely patient. You have to be extremely knowledgeable about their condition. In other words, you know, if they have, there's all different types of dementias and all different types of issues that they have. Some are very cooperative, some are not cooperative. So you have to have this unique ability to get them to cooperate, whatever it takes, whether they think that you're their friend or that you're related to them. I mean, if they say, you're Susie, my sister, right? I'll say yes, because I want them to cooperate. So you go along with them. That's one of the things that you must do when you're dealing with dementia patients. And I put dementia and Alzheimer's all in one bucket, even though they're different and there's so many similarities. You just have to really know a lot about their actual personal issues before you even treat them. I like to find out if they're right-handed or left-handed because that's their dominant side. And I like to talk to them in that ear or from that side. You have to approach them always straight on. You never want to say, hey, the dentist is here from behind. That scares them. That sets a tone immediately that might not make your visit very, very successful. So you have to look at them in the eyes. You have to be very quiet and soft-spoken. You have to say the things that they want to hear. And sometimes, you know, big fibs like you're their old dentist or you're their daughter's dentist or you're whatever it is. And you have to get them to understand that you're there to help them and whatever it takes for them to open. I mean, sometimes it's easy as all heck. And sometimes, you know, you have to fight them and it's going to take more time than it would normally take, which is one of the big issues that I have, you know, because I go from one house to the next. I like to ask on my new patient form, do you have a fear that the patient will not cooperate? And if they write yes, I know to book an extra half an hour so that I'm not so late for the next patient.
What about those, Dr. Kaufman, those individuals with chronic conditions? Do you find that they're more susceptible to oral diseases?
Sure. You know, diabetes is a major issue. My grandmother had it, and I remember her dentures kept being repaired, and I didn't understand. I was not a dentist at the time. But what happens is your teeth really dry out. Diabetes does something to your teeth it's extremely difficult to control. So she was always breaking and losing teeth, and they were always fixing her dentures. Some of the antidepressants are also very irritating in terms of dryness. They dry out your mouth, and so it's important to take care of that. You don't want to have dry mouth. A lot of people get canker sores as they age, and that could be a result of the sulfates in the toothpaste. So that's why I recommended the closest, because that's non-irritating. You want to use very gentle products. You want to use things that are low in abrasivity in terms of toothpaste. And some toothpaste, as I said before, are very abrasive, and you don't even realize you're not doing a good job and you're actually harming your teeth. So there's a lot of things that you need to know in terms of side effects of your medications. And if you are like having radiation treatment, you need to have fluoride trays made. These are things that your doctor will tell your dentist about, and how to make sure that you keep your teeth through, God forbid, radiation treatment. And dry mouth is really a side effect of all medications. So like I said before, it's really important to drink a lot of water. Being hydrated and keeping your teeth moist is extremely, extremely important.
So if I think about a dentist, and I may be wrong, Dr. Kaufman, that it's not typically the ongoing relationship. You go see your dentist once per year. What's
Twice.
different when you're twice? So see, there you go. I'm already in trouble. Um, when we're talking about the older population, the aging population, what do you recommend as far as having that relationship with your dentist?
It's really important. And you have to ask questions. And if your dentist isn't patient, you need to find a new dentist. And I'm not joking, because some people think, you go to see the same dentist your whole life, you have to continue to go to that same dentist. No, I totally disagree. All you need are your x-rays, and you should go to a dentist that really understands your needs. And not everybody wants to do a lot of treatment when they get older. I'm very, very, very sensitive to when someone calls me in for a second opinion for their 99-year-old mother who has a root tip in the front of her mouth that's been there for like a year, and the dentist, her regular dentist, says you have to extract it. And I say, no, she's 99 and it's asymptomatic and it could always be extracted, but if we extract it, then she's not going to eat for 3 days. She's going to be irritable. She's not going to understand what we're doing. Just leave her alone. And, I think less is more, especially as you are in your 90s. I mean, we have ways of watching these situations without doing something about it immediately. So it's really important that you have a lot of confidence in your dentist, not just that they don't hurt you when they drill. Oh, I love my dentist. Why? Well, he does a filling on me and it doesn't hurt. Well, okay. You need to be able to ask questions. That dentist should be able to take your call. If you're concerned. I just got right before the show, I got a text message with a picture of a swelling over a tooth from a patient that texted me and said, should I be concerned? And I said, well, I'm going to call you after I finish with knowledgeable aging, and I'm going to discuss with you, is it a hard or soft? Is some food get stuck under there? You must have a great relationship with your dentist, and your dentist has to understand your personal needs, know all about your medications, know if you're on blood thinners, know the products that you're using, just like your physician would. And as you age, you need to find somebody that really understands your issues, and not just somebody that looks at your teeth, takes x-rays, and tells you have no cavities and says, see you in 6 months.
Yeah. I was just going to say, Dr. Kaufman, you just touched on something. I'd like people to think about reaching out to their doctor if they have weight changes or stuff like that, but it's just equally important as you age that there's that cooperation with your dentist and your doctor and you. It's not just you and one person or one professional, right?
Let's try to remember that oral and systemic conditions are completely related. I mean, the first thing that you do is put things in your mouth, and from there it goes into your throat, your stomach. Everything is connected. So the foods that you eat, if you're sucking on candy all day, and I come and I see you and I say, oh my gosh, your teeth are, what is going on? And you say, well, I can't really eat. My mouth is so dry, so I suck on candies all day. I mean, that's really important because you're ruining yourself. And plus candy and digestion, you must understand that everything that you do, starting with the foods that you eat, the rinses that you use, all of that's connected with your systemic health. So I have diagnosed diabetes just from someone's mouth odor that didn't even know they had diabetes. When I do an exam, I feel I do an intraoral and extraoral. I have actually palpated nodules on the thyroid that the patient went on to find out that there was something that was going on. So, think of your dentist as a doctor of the mouth. We're not just, like plumbers that you go to like when your tooth chips. We are doctors of the oral cavity and doctors of everything from your nose to your chin. Okay, so you have to really, really have a knowledgeable dentist who understands that and doesn't just treat your teeth like they're just teeth.